Okay, so we're going to talk next about the stages of wound healing. And I want you to think about these in terms of both internal and external wounds. In the inflammatory stage, a wound triggers the inflammatory process. So in the inflammatory stage, the first thing that happens is vasoconstriction to control the bleeding. And then we start to form clots to stop the bleeding on a little bit longer term basis, kind of medium term. And then later on in that inflammatory phase, we get vasodilation to increase the delivery of oxygen, white blood cells, and nutrients for healing. So if I cut my finger, immediately it vasoconstricts for a bit, and then a clot begins to form fairly quickly if I have good clotting, and then I vasodilate to that finger because I need to increase delivery of oxygen, nutrients, and white blood cells to prevent infection and begin the healing process. So I'm going to get redness, swelling, pain to that area. In the next stage of healing, that lost tissue starts to be replaced with connective tissue, granulation tissue, collagen. So in a wound bed, you can see that nice pink granulation tissue in the proliferative stage. It's in the second stage. We also begin to have some epithelial cells. In the third stage, that scar strengthens and the skin begins to look more normal. We also start to get some more organized epithelial proliferation. So we get some more organized scar tissue here. In this stage, the scar gets stronger. Now, if the scar is very small, we may not see it, and the scar may not be visible. So I have a paper cut on my finger. I think I found that yesterday with some gel. I have a little cut on my finger. When that heals, there will be scar tissue, but it will only be a few cells. And so that will not be something that's visible or that I notice to affect my, function. But scar tissue does not function the way normal tissue does. And so when you have a larger scar, that scar tissue does not function as normal tissue does. The healing process, we talk about 3 different types of healing process. So we looked at the stages of healing. Now, there are 3 different ways in which a wound heals. If I have a wound and the edges are approximated either naturally or intentionally by sutures or staples, that if that wound heals rapidly, it's a straight line like an incision or like a simple cut. The edges stay approximated, it's going to heal rapidly, there's a low risk of infection, and there's minimal scarring. So back to my little paper cut, those edges are going to be approximated. That's going to heal pretty quickly, and I'm not going to have major scarring there. Now, secondary intention is when some tissue is lost. So years ago, and I think it's almost disappeared. No, it's still there. When I was in high school, I gouged the back of my hand on the corner of a cabinet. Okay. And in that space, I lost some tissue. So when it healed, it filled in kind of from the bottom. And so it did not close like a cut. It filled in from the bottom. So the wound edges were not approximated. It was a larger open wound, and so there was greater risk for infection, and it caused more scarring. And I think probably over 30 years later, that scar is still visible on the back of my hand. So if we have a wound that heals by secondary intention, we're going to have more scarring. So think about things like that really big decubitus ulcer. Sorry, my brain just lost that word. That really big decubitus ulcer. That's going to heal by secondary intention as it heals. And so you're going to have a lot of scar tissue. Now, tertiary intention is when we have a widely separated wound. It's deep. It may be infected. And they usually are going to leave that wound open, or it may be a dirty wound. Maybe it's not infected yet, but it was a dirty wound. And so they want to leave that wound open at first. And then once the infection is cleared, it's surgically closed. That's called delayed primary or intention or tertiary intention. Now, it's not the same as primary intention. I have my simple straight cut that heals and that heals naturally, or I have an incision that is sutured. It heals naturally because those tissues are approximated immediately. So the tissues are going to bond together, it's going to heal back together. If I have an incision that maybe dehisces because of infection, it's left open and packed until the infection is cleared. The edges of that wound that are open are going to start the healing process. So then when it's reapproximated, the internal healing is not going to be the same. So that's called tertiary intention. So you need to know primary, secondary, and tertiary intention for healing. There are a lot of things that affect whether and how well something heals. Age affects healing because age slows down our immune systems and slows down a lot of body processes. As we age, we also are more likely to have disease processes that affect our immunity and also affect our circulation, our ability to perfuse body tissues. Our general health affects healing. If someone has been sick for 3 weeks and then they get a cut, that cut may actually heal slower than it would normally for that person, because our general health is going to impact our body's ability to go through that process of healing. Decreased white blood cell count, you know that, but that's because white blood cells are really critical in the initial part of that healing. White blood cells cause they actually clear a wound of harmful organisms, but they also trigger the healing process in the base of that wound. So decreased white blood cell count slows healing. Immunosuppressant medications, because it causes decreased white blood cell count and it suppresses that inflammatory response. If we can't have inflammation, we're going to have a hard time healing. Nutrition. Protein is probably the most important nutrient as far as healing. So we add protein to patients who have major wounds, but also there are some micronutrients that affect healing. Vitamin C is a major one. Zinc affects skin integrity. So nutrition deficiencies affect healing. Tissue perfusion. If your patient does not perfuse their tissues, they're not going to get oxygen and nutrients and white blood cells to the tissue to be able to heal it. So ineffective perfusion, ineffective oxygenation. If tissue is not getting enough oxygen, it's not going to heal. Tissue that's not getting oxygen is dying. Oxygen carrying capacity. So if someone is very anemic, they don't have enough red blood cells to carry oxygen effectively, that affects healing time. Obesity affects healing because adipose tissue has poor blood supply, so it takes longer for that tissue to heal. Smoking. Tobacco is a vasoconstrictor. Smoking also impairs oxygenation, so smoking slows down healing. Mechanical stress on a wound. If I have a wound on my head, my skull is pretty hard, so if that's well sutured, it's going to stay in place and heal, right? But if I have a wound on my abdomen, everything under that shifts and moves around. And so the constant movement of that tissue makes it take longer to heal. But also, if I have mechanical stress on that wound, if I've got that wound getting stretched or pulled, then it's going to take longer to heal. But because it's constantly being pulled apart and having to rebuild that collagen. Chronic illnesses tend to slow healing. That makes sense because our body's energy is in dealing with the illness, and that leaves less of our body's reserves for dealing with infection. Let's see. The last piece, in fact, I think I'm going to move that to the next section. In the next section, we're going to talk about assessing wounds and the principles of wound management.